Well, first of all, the diagnostic is a tool. And the tool is actually only as good as the person that we provide to help you use that tool. But the tool is an opportunity for the organization or the project, because it depends here a little bit on the size of the organizations that we're working with. But it's an opportunity for people to sit down and to conduct, if you like, a complete review of their organization, all facets of it, and to arrive at some kind of a sense of, well, where's the priority for making improvements? Where do we want to set the bar a bit higher? What's the priority for setting the bar higher in this area compared with another area? So it is about the performance, if you like, improving the performance of your organization. And we've got one of the projects that's been funded through the first round this year, and I'm sure one of the things you might want to be interested in asking and hearing about is what was it like for her and her organization. The intention is that whilst it's facilitated by a specialist, and here we're looking at people who have not only used an organizational diagnostic in the past, but are very familiar with the sector. And therefore their familiarity will enable them to help you maybe make some connections and give some thought that you wouldn't necessarily be able to do from your own resources. But the important thing is that this diagnostic has to be owned by you. It isn't a diagnostic that is for us as the managing body. That's not its purpose. Its purpose is that at the end of it, you as an organization say, that was an experience which was well worth having. I now have a sense, I now have an action plan, which I can try and work to with my staff, with my trustees, as we try and keep pushing the boundaries of continuous performance improvement. The data that's collected from that will actually help to inform some of the training that is provided and will help to inform the support consultancy, but it's not the primary purpose for doing it. The primary purpose is that it should provide you and your organization, or you and your project, with a clear sense of the actions that you are committed to taking as an organization to help improve your performance. So the areas that it covers are, in a sense, there's nothing new about the areas. They are, if you like, a 360 assessment of all aspects of your organization, from governance through to delivery, from finance, including HR. It's intended to cover the organization in a holistic sense. And as I say, so the topics themselves are not something new, but it's only of value when you start to think about, well, who am I going to involve in this process? Who within my organization, my project, would it be valuable to involve in the particular process? And it's only valuable when you also have a specialist who's a facilitator for this to help really extract the maximum from using the tool. A bit of process here. The diagnostic, by the way, has been refined for this particular fund. We did some work around we used the diagnostic tool with the youth sector organisations. We refined it and we trialled it, in fact, before the first round were exposed to it. And we've now had an experience of using it with 40-odd organisations. So it's something which has been road tested. So we will select the person that will help you to undertake the task. They'll get in touch with you. You'll get, as you can see, a copy of the diagnostic in advance, so you can see kind of how it works. But the key question is really around this one here, about who to be involved. And because, as you've already heard from the nature of the questions, we've got such a wide range of organisations. We've got some tiny organisations where you might do the diagnostic on the whole organisation In other areas, we've got projects that are part of something much bigger. So clearly what you want to do to begin with is make a fundamental decision around what's going to be covered by the diagnostic in its, when you do it. The person conducting it will facilitate the whole process and will complete a report which then gets posted, in fact, on the site. And it's available for people to look at here when they're looking at making decisions about, well, while there's some particular patterns that are now falling out of this in terms of training in particular areas, consultancy or support in particular areas, and of course it's also very useful data when you aggregate that back in terms of giving some feedback ultimately to the paymaster, the Department for Health, about the areas that people are highlighting where they have the most need. So there is an aggregation process which this enables us to do.